Good afternoon, my friends. Today I would like to share the situation and how to control COVID-19 in the factory and also in the hospital in Thailand. When we take a look to the situation of COVID-19 in Thailand, in this week we had confirmed case around 336,000 cases. That is very high number. But in every day, we have around 8,000 to 9,000 cases in every day. And for the dead patient, it's around maybe 60 or 70 cases per day. So we take a look and focus on the how to control the COVID-19 in the factory. We have DMHTT. That is the basic control measure in Thailand. D is mean that social distancing, that around 1 meter and 2 meter. For the mask wearing, M. H it means hand with washing. You have to frequent or often hand washing. For the T, we have 2 T. The first T is mean that COVID-19 testing. And the second T is mean that Thai Chana. Thai Chana is the application that we use to track the person who enter the department store, enter the market, or enter the workplace. They have to check in. And when they check out from that place, the Thai Chana, you can track the person when enter in the workplace. For the how to control COVID-19 in the factory, we have strategy. It's a bubble and seal strategy. This picture we show the seal strategy. Seal strategy is mean that the workplace have accommodation and can supply foods for the worker. The worker don't permit to go outside. They have to stay in the factory and in the accommodation that located in the factory. And the factory have to control the outside person. Don't permit to enter in the factory. The worker have to test frequently. If we get the positive, the factory have to send them to the field hospital. For the negative worker, they can work in a normal situation. This, for the seal strategy, they take 28 days. For the bubble strategy, if the factory don't have any accommodation, the worker must go to the house, must go to the dormitory in each day. But they have to track the worker and got the timeline of the worker. They don't permit to go other place except house and factory only. And other, they have to test the PCR often. And if they got infected, they have to send them to the field hospital. This is the bubble strategy. The criteria of bubble and seal. If the worker have underlying disease or obesity, we don't recommend them to get in the factory during the seal or bubble strategy. And for the new employee, during such time, we stop and try to don't entry the new employee during such time. DMHTT was used strictly for them. The other control measure in the factory, except DMHTT, vaccination is very important, especially right now that a lot of cases in Thailand. Engineering control for the good ventilation is very important. They also have to, the factory have to establish the BCP plan because they have to prepare like personnel or other resource if the worker got infected, and the worst scenario maybe the factory have to shut down. This is very important that they have to prepare. And also the response plan and practice preparedness is very important. If they found the COVID-19 in the factory, how to manage them. I have a chance to training how to prepare and respond practice. So we set scenario like if you have the suspected case in the factory, how do you perform, how to send them to the hospital, how to clean the area, and how to interview them, how to what PPE you have to use, and what the action of the leader, or what the action of human resource, or what the action of safety officer. I think it's very important that they have to know. That is the factory part. So we move to the hospital part. The hospital part we mentioned in healthcare worker. Right now we have healthcare worker around 7 cases, but I think it's currently today maybe more than 800. However, the proportion of percentage of total COVID-19 case in healthcare worker, the proportion is quite low when compared to the total number of COVID-19 in Thailand. And around 70% of healthcare workers can get the vaccine. The what professional who work in the hospital that get the highest number? Surely nurse, because this is the high number of nurse in the hospital. The second one is radiological technician. Other is housekeeper, security, or back office. This is the high number of healthcare worker who got infected. What causes? Absolutely, they care of COVID patient and they got infected. They contact from other staff, maybe they have food together, or they cannot take social distance in some job. They screening of suspected patient, they clean and waste collection in the hospital. They work related infection for non-identifiable cause. 1 to 5 is work related, but the 6 is from community contact. When we see the mental health, we found that around 3.5% severe stress, and is importantly around 9% they got depressed and burn out 5%. Hospital daily life, surely DMHTT, particularly physical distance, hand washing, and mask. And also how to enter the hospital, they arrangement the hospital entry and health screening. Layout and flow. They have to set the screening area, how to flow the patient that have suspected case, how to flow it, they have to lay out in the hospital. And ventilation design, especially in dental unit, in operating room, or something like that. PPE arrangement for each job is different PPE used. I think DMHTT is very important because with this control, I think we can save together. Our member, you can learn from Thailand study, and you can adapt to your country, and we will save together. Not only Thailand, I think in worldwide. We hope we will be safe. Thank you.